you have come across these headlines in the last few weeks, you may have wondered if this is the beginning of the next pandemic. Hello and welcome, you're watching Happiest Health. I'm Revati. In this episode of the Y-Axis, we look at why children in China are falling sick and if you should be worried. Here's a timeline of what has happened so far. Since mid-October 2023, China is seeing an increase in respiratory illness in children. On 13th November, China's National Health Commission confirmed a nationwide increase in the incidence of respiratory diseases, predominantly affecting children. What is alarming is that this surge is being seen sooner than expected in the flu season. On 22nd November, the World Health Organization identified media reports about clusters of undiagnosed pneumonia in children's hospitals in several places in northern China. The WHO made an official request to China to provide additional information on these reported cases. On 23rd November, the WHO held a teleconference with Chinese health authorities. Here's what the Chinese authorities said. There is an increase in outpatient consultations and hospital admissions of children. This increase is due to lifting of COVID-19 restrictions and the arrival of the cold season, and due to circulating known pathogens such as influenza, mycoplasma pneumonia, RSV, and severe acute respiratory syndrome coronavirus 2. Mycoplasma pneumonia is known to affect children more than adults. It is a common respiratory pathogen and a common cause of pediatric pneumonia and is readily treated with antibiotics. This is also called walking pneumonia, a non-medical term for mild pneumonia. Has there been a similar spike in cases in India?
Definitely in India also. Winter brings a lot of infections in children, especially respiratory illnesses. Mycoplasma pneumoniae can affect a child, especially after a viral infection, because the lining of the respiratory system, the respiratory tract is already weakened and inflamed because of the viral infection. And then the bacteria can gain entry into the lungs and cause a pneumonia.
Meanwhile, there are reports of surge in cases affecting younger children in Denmark, Netherlands, and France. With cases seen in Ohio, senators in the US have asked President Biden to impose travel restrictions to China. Here's what you should know. There is no evidence of any new or unknown pathogen. The WHO has not placed any travel restriction or any specific measures for travelers to China.
So far, whatever China has told and what WHO has clarified, what we know on that basis, if there's no new pathogen, then we know the medication of all the existing pathogens, how to treat them. We know how they spread, and they do not spread like a forest fire as COVID did, because it was totally a new pathogen with no pre-existing immunity. So as long as we are not dealing with unknown, we are good. But we have to be careful. If the pathogen is usual, it is a routine pathogen, still also we have to be careful about our flu vaccinations, pneumonia vaccination for vulnerable people.
Here's what you can do to reduce the risk of respiratory illness this season. Take the recommended vaccines against influenza and other respiratory pathogens as appropriate. Keep distance from people who are ill. Stay at home when ill. Get tested and medical care as needed. Wear masks as appropriate, ensure good ventilation, and practice regular hand washing. In general, the WHO has recommended that persons should avoid travel while experiencing symptoms suggestive of respiratory illness. In case of symptoms during or after travel, travelers are encouraged to seek medical attention and share travel history with their healthcare provider.